selling mobile phones to 70-somethings who just were not ready to adopt them, right? And the nurses who were in charge of the program kind of sweetly came back and said, gee, Doug, what I want you to do is put on big, heavy work gloves, and I want you to put on these crazy glasses that don't belong to you, and I want you to try to use this device. And that's what our patients are trying to do here. So there's an example of research that in some ways failed, right, because we didn't power the study and we didn't get an intervention and all that jazz. But what we did get is some very early kind of indications about what is the right technology to give to the right individual in the right way.
I think this is a great question. I offer my two viewpoints here. First of all, over the last 5 years, we have seen advances in technology that makes the consumer less kind of a active user, but more like a passive experience, that the technology taking care of a lot of things. So consumers don't have to push many buttons to go navigate through a lot of menus, but it's more simply, pair devices together and get the data transmitted, or have a function that building the device itself, so that the patient don't have to upload software and do a lot of things like that. And the second part of that, I think it's more about let the consumer know the value proposition of technology itself and increase the compliance rate of technology. I think that's a very important aspect of that. If you don't let consumer understand what's the value of the solution, what kind of technology can help them achieve, you won't get benefit from that. I'm just offering from my own experience, the Wii Fit Plus the application. That application definitely, I think it's easier for even the seniors to understand what's the benefit of that and how easy to use that technology in your home or maybe in assisted living facilities. I think that's the best example in terms of how technology can shape our consumer or patient behavior in terms of using technology, and set a good example for other industry players to follow suit.
Zach, you have anything? You're running.
They covered most of it. Just another thing linked to this, and this is a little aside from technology, which is the focus of all of this, but things like patient selection criteria by the nurses is extremely important. It's almost a hinging factor around this, sometimes superseding technology. Those nurses have to pick the right patients for the right technologies, for the right programs, et cetera.
I just want to add one other comment to that and we go to the next question. When people start talking about whether seniors will be able to use the technology, I always a little bit shrink back on that because I worked in aging for many, many years. And my mother used a cell phone and used a microwave and used a portable phone. And all of those 20, 30 years ago were this brand new advanced technology, and boy, nobody would ever use it. And now they're using it. So seniors are maybe a late adopter of technology, but they are an adopter, and I think that's going to change. So you have that changing, and at the same time, as Doug mentioned with the mHealth and other applications, although at the time the cell phones were maybe big, the people Jitterbug may have some other comments on that today, but nevertheless, all of that's changing too. So we have both those things, I think, coming about. But yes, sir.
George Margell, Singapore, Australia. 25 years ago when I was in med school, we were taught you have to engage with your patients, you have to spend time with your patients. You hit awards, and the reality is that you get 2 minutes and you've got to go from patient to patient. To what degree is this technology basically just re-enabling that engagement with provider and patient, so taking us back to what we were taught in the good old days, and where do we see that going forward?
So the people here, to what extent is the technology re-engaging the patient-physician relationship, and to what extent, and where is that going to go forward?
So I'll jump in and just say, when we think about the 4 cornerstones of how we think about connected health, that last cornerstone is how do we leverage the provider properly. And whether it's an activity and weight program or it's a how to get your control of your type 2 diabetes or get your hypertension under control, et cetera, these are all tied back to care plans that are generated by a physician, right, and are monitored in some way by a care team. And whether it ends up as a wellness program or a true healthcare delivery program almost doesn't matter, right? It's about how do we support the relationship that is created between a care provider and the individual. But we also know, just as you were saying, that the care providers just don't have the time, right? The system is not designed to let them have the time, and in the end we know from a demographic crush kind of perspective, they're not going to get that time. So this is the technology really should all be in support of how do we get people to do a better job of taking care of themselves, which is what the providers want in the end, right? Is here, I build you a lovely care program. I want you to follow it and do it, right? So how do we get people to do a better job of taking care of themselves? And then how do we leverage it back into the care process when it's most appropriate?
I think the patient engagement, I think, is a very important topic. If you look at, I mean, the problem is very obvious. You know, patients don't have much time face-to-face with doctors these days. But I think there are two things happening that makes this communication or engagement easier for both patients and doctors. First is the incentive in terms of payment reform that, you know, Paul this morning, the keynote mentioned about all those reform efforts will compensate physicians for the time spent communicating with patients. That's one side of that. You talk about pay for performance, bundle payment, or medical home models. I think that's a very important part to make physicians understand that their work is not going to be wasted. And second, there are technology platforms that enable the doctors to communicate with patients on multiple levels or in whatever tools the patient chooses from. You know, for instance, the current patient portal services by providers can engage patients on the web through IMs, through text messages, like that. And if you look at Seattle-based group health cooperative, you know, they have shown that, you know, physicians, if given them the right tool, given them the right incentive, you know, the physicians are willing to communicate with patients on a constant basis. It's not the absolute minute, you know, it's not a 2-minute that, determining the patient's satisfaction about experience. It's more like a consistent, constant information exchange between the doctors and the patients that will make patients very satisfied about experience. And so, I mean, it's not increase the face-to-face time from 2 minutes to 5 minutes. It's more about during the course of 1 year or maybe 3 months period of time, for certain conditions, the patients or their their nurses communicate with patients on a constant basis, whenever on-demand kind of fashion that will drive the satisfaction of the patient experience.
Some quick comments by me, and I'll turn over to the next question. It's really key to differentiate what kind of care delivery you're doing with these. If you're doing something that's replacing a physician visit or some sort of clinic visit, there's a lot of pilot programs out there. The one that comes to my head immediately is Walmart ran a clinic program where the on-site clinic, it was in Houston, was run by emergency care personnel, emergency ambulance personnel, no nurses, and there was a doctor who performed tele-video, the actual portion the doctor would perform through a video teleconferencing system. They utilized text messaging, just very, very simplistic stuff. And that was the way they ran their clinic. And there's been a lot of success with those types of, they haven't seen a lot of takeaway or lack from an in-person visit to a tele-video visit. But when you get to what programs like what we described today, where those aren't really, there's no video consultation in a lot of those. A lot of people have tried, but they've been taken away in some instances. Some technologies have taken away their video capability from infrastructure reasons and such, IT infrastructure. So when you get to that, you're really trying to find out, and traditionally telephonic communication has been what these nurses have done to their patients. And so figuring out in the future what's really going to replace that, or if something's better than the traditional telephonic communication that a nurse or a doctor has with their patients through these remote systems. What's better than that? Is texting okay? Is any of these other programs? And there's some positive things, but they're still very much being felt out right now.
You both talked about the area between clinical healthcare and wellness healthcare. And Doug, maybe you could expand a little bit more on some of the things that the partners is doing in the area of those programs, what they are, and also very interesting is how do you promote them, or who do you promote them to? Who are the consumers, the buyers that you think are going to be the people to take for?
Sure. So I'll give 3 examples, and I'll describe who pays in each of those examples. So if we're talking about heart failure remote monitoring, it's generally what's happening is Partners Healthcare is paying for those programs in some kind of cost avoidance model, right? Under whether it be prospective payment for home care services or getting ready for 30-day readmission to hospital rule changes for Medicare, Partners is investing in paying for the remote monitoring of